Namaste, Jai Hind, and welcome to yet another edition of the Quality Dialogues. The focus in this edition is on healthcare, ladies and gentlemen. India is now providing to the world, not just as a pharmacy, but also as a healthcare service provider. So all the more important that our healthcare services meet international standards, and thereby the role of the NABH, or the National Accreditation Board for Hospitals and Healthcare Providers, becomes all the more important. Today, we'll be in conversation with someone who's not only been former chairman of the NABH, but he's played nearly 3 decades of contribution and role in trying to improve healthcare services in our hospitals. He's also Padma Bhushan, which he was awarded in 2009, and it gives me great pleasure to be in conversation with B.K. Raoji. Namaste, sir. Thank you very, very much. Azadi Ka Amrit Kal, 75 years of our independence, we are celebrating it, but this is also 75 years of healthcare services. What are the kind of strides that we've taken, be it paramedics, be it hospital, healthcare, over the last 75 years? And would you agree, disagree if I were to say that it's the last 10, 12 years when we've actually taken greater strides?
I think like we are celebrating the Amrit Kal, or the period of our independence, 75th year. With pride, we can say with pride that India is a success story in terms of healthcare. When we had our freedom from the Britishers way back in 1947, our healthcare was rudimentary. Our main problem right from the beginning has been that of access, and then after access, the affordability. So tackling that issue, from something like 28 medical colleges, today we have 650. And you are right that the last 10 years has seen a phenomenal growth in terms of the capacity building. Same is the story with our, let's say, the number of MBBS seats. We are 99,000 plus. And if you look at the WHO, who says we should have 1 doctor per 1,000 beds, we are almost there. But these 99,000 seats, after 5 years, will come out in clinical practice. So you can imagine the capacity building we are creating for future. We will be the biggest contributor, or one of the largest contributors to the population growth till 2050. But we are getting ready with that. When it comes to the others, nurses, allied healthcare workers, I think we are quite very much there, and we are creating that capacity where we are covering almost 1/3 of the population, which is below poverty line, because that is where the real affordability issue was there. The access, again, the digital health mission is going to be tackling that issue also, because we have seen doing more of what you have already done doesn't really solve anything. You have to have a smart healthcare system. And that is what the present dispensation has created. They have changed the face of healthcare. How do we deliver healthcare? That is being changed. And that is being made more effective, more efficient, and more inclusive. So, all in all, I can say it has been a success story.
Now, you talked about digital health, and so let's talk a little more on that. Pradhan Mantri has also talked about moving to digital platforms. So how is the digital health mission taking shape? Are there great learnings from Ayushman Bharat and also with CoWIN, which we are now going to take further?
See, digital health was there earlier also, but they were largely with individual players, small startups, individual players. We knew that we have the strength in IT. COVID taught us, it gave the flip. And then we realized that going from face-to-face healthcare to a virtual healthcare is something which is still very efficient, effective, and still a preferred mode for a lot of people who are not particularly interested in coming to a hospital which is maybe far, far off. So digital health took place. We learned how to talk to patients, how to talk to the relatives, how to give our consultations using telemedicine. That was the genesis of it. But on top of that, in 2017, when the National Health Policy came, it really laid down the groundwork for that. Okay, how should digital healthcare progress? And why? Because we have realized that if you have to scale up, then physically scaling up things will never make you reach where you want to reach.
Got it.
We have a large population, 142 crores. So if we want to scale up, then digital health is the answer. Today, I think over 98% or 96% of the villages have internet connectivity. And I think over 70% are using internet connectivity. And we probably is one of the largest mobile country, mobile user country in the world. So you can imagine that we have the capacity, we have the intent, we have the appetite, and we have the preference also. We have put the systems in place, we have the structure in place, we have the priorities in place, we have the timelines in place.
What is the role of QCI and NABH? Because you were sharing with me that accreditation largely is voluntary. But in terms of government services, which are largely welfare driven, how does NABH play a role?
If you are accredited, that means you've undergone a process of third party peer review, all right?
Yeah.
With focus on your compliance or your adherence to the preset standards.
Right.
Now, what are these standards? These standards are the standards of quality. And a whole lot of effort has gone into select them, identify them, fine-tune them, and make them implementable. The people who have undergone accreditation can vouch for it that in terms of the structure, process, and outcome, they have everything in place. People who have not undergone that, I'm not saying that they don't have it or have it, but they can't vouch for it. So they may have it, they may not have it. They may have part of it, they may have none of it.
Correct.
They may have all of it.
Yeah.
But the matrix that we have laid, the measurement matrix of quality, only comes from the standards. So in terms of the quality, there is nothing for them to measure what kind of quality are they maintaining, how far are they maintaining. So what do they say? We are world class. We expect them to keep improving. That's the focus, that's the thrust. And that is what is not there in those who are not accredited.
What is HOPE and how is it going to bring a certain level of standard for entry-level organizations?
You see, accreditation at one point of time was kind of threatening. Okay?
Correct.
People used to say, oh, this is very complex, this is very difficult, how will we do that and all. So came the entry-level certification. The one we have, the full accreditation, that is as per the international standards, the ISQA, the International Society for Quality Promotion. But the one we have created our own, it is based on the same system, but more of a realistic one. Okay. So institutions which do not work on that level of operation or the scale of operation, or maybe they are smaller hospitals, they want to reach there, but they don't want to get lost into the process. So we created a simpler process for them. And one of the simplification was the HOPE portal. So not only the standards were made simple, the process of accreditation was made simpler. So HOPE is basically a platform, which, as it says, it is healthcare organizations, portal for entry-level certification. But HOPE in true sense is a hope for them. So more and more of them are joining. Now over 7,000 are already in line. So they find it easy, it is faster, quicker. And on top of that, when we were in COVID, when nobody could go and do the physical verification, we used technology in a big time into HOPE. So whenever we asked somebody that, okay, show us your place. So he will take a tablet and go there, which was geotagged. So it was live streaming. And we knew that he's showing his own hospital and not some other hospital to me. So that was possible only with HOPE, because HOPE is a digital platform. We did a lot of webinars, seminars, classes, and accreditation and the certification, largely because we use technology.
How far are we from international standards of healthcare? How much of a role does digitalization and also standardization play in trying to bring our healthcare services at par to international standards? Because one of the focus which the Prime Minister has said very clearly is that India is also a big destination for medical tourism, and the development of medical infrastructure across India is also not just allowing better healthcare services to the people in India, but also attracting more people from across the world for healthcare services.
What is an international standard? I mean, somebody has to set that standard.
Correct.
So there are bodies who set that standard, okay? We do that and they will recognize our standards. Or they will set their own standards. So for example, Joint Commission. Joint Commission sets their own standards. Whereas what we do is we set our own standards. Our standards are then accredited by an international organization, which is ISQA and ASQA, the Asian and the international one. Right. So they look at our standards and they say you are at par with the international practices. Okay. The best practices of quality and safety are there in your system. So based on that, we have 10 chapters, and in 10 chapters, we have then the standards, and in each standard, there is an objective. We are not prescriptive. We do not tell them exactly how you do that. Take first left step and then right step. No, we don't tell them, but we tell them walk straight.
Okay. India is being projected as the voice of the South Bloc, voice of developing nations, the bridge between developed and developing nations. Are there countries which are also looking at us as far as quality standards, accreditation standards, NABH, and they want something similar to NABH or what NABH is doing? Is that also something which we are seeing, that nations want to follow our healthcare systems?
Yes. The society with which we are registered, they have got a whole lot of other countries registered with them.
Ji.
What happens is, one is a standard, the other one is the process of accreditation. And for the process of accreditation, you have to have the infrastructure in place.
Right.
The countries which do not have the infrastructure for accreditation in place, who do not have their own standards, they look out.
Correct.
They look out for an organization which can do it for them. And they look at their standards, and they also look at the other aspects of it. One of them is cost.
Cost, correct.
Okay. The cost of getting the accreditation, maintaining it, and then getting it again. So recertification or re-accreditation. So that is where they find India, and especially NABH, very attractive. Because they realize that they are as good as the others. And like India always claims with pride that our services come at a fraction of a cost. And with the same quality. So the same is true with NABH also.
Now, when you talk about accreditation, there has to be a certain level of standards that have to be set. So there's a standardization process. Can you take us through how rigorous is this? What forms the process of accreditation via NABH? So, and what kind of standards has the QCI NABH under QCI set for hospitals and service providers to be accredited?
What happens is the process, how do you set a standard?
Correct.
That is where we have reached a level of maturity. We have the capacity, we have the knowledge, and we also have the technical expertise now. So our committee will collect international standards, look at all the international practices, go through the academic proof, let's say the scientific proof of what constitutes or what can constitute a standard.
Right.
So whether you are revising it or setting a new one. And after that, this committee will deliberate. After their deliberation, then it will be released into public domain.
Right.
We want public to react to it. It will be released to all our stakeholders because QCI and NABH has stakeholders in it. So they will all be given a copy of that. We want feedback from them. And after receiving all that feedback, then we approach the international society that, okay, these are final standards. We want you to have a look at them.
Got it.
If they accredit our standards, then they get implemented.
Okay.
So what do we do? The process of setting it up standards is very standard. One, it is thorough. Secondly, when the standards have to be implemented at the field level in a hospital, it requires clarity.
Yeah.
And that is where NABH does a lot of effort in conducting seminars, webinars, and programs on implementation. So we want the people to know what these standards are.
Got it.
The standards are freely available, free of cost at our website. So anybody can download them and go through them. And on top of that, the office is very open to receiving calls and sorting out, kind of things, chat box and all. After that comes our assessors, who are our eyes and ears on the field. And the assessor training is one of the paramount priority for us. We want the assessors who are well qualified, who have all the prerequisite qualifications and in terms of the other traits that we want in them. And then they are put on ground. And when they are on ground, then they will make their observations. Hospitals are given chance to whatever are the non-compliances to comply with them. And when there is a non-compliance or when all of them are complied with, it is sent back to an accreditation committee and they will go through that. And we have a full range of, what we call as a natural justice. So we have an appeals committee.
Appeals committee, okay.
So if you don't agree with what the AC committee has said, you can always appeal to that. And the appeals committee then makes a recommendation to the chairman, who is the final authority. And that's how the process goes.
The other point is, see, supposing I'm somebody who's looking for healthcare. There are 2 hospitals in my vicinity. One is accredited, one is not accredited. What's the difference? And why should I, as somebody who's looking for healthcare, push for an accredited hospital? There is a push and a pull also. So can you explain that to us?
Okay, let's go back 50 years, 30 years. How did I choose a hospital? Or how did I choose a doctor?
Yeah.
I will ask somebody.
Recommendation.
Have you been to some doctor?
Correct.
Have you? So
Yeah.
feedback, recommendations. Okay. Number 2, medicine has become very complex.
Yeah.
So not all hospitals have the same kind of services. Not all hospitals have the same kind of expertise.
Expertise.
Okay. And that is where there is a need now to go or look to an agency which can vouch for the kind of service that you are wanting, the kind of doctor you're looking for, the kind of hospital you are looking for. And in that sense, the accredited hospitals, as I said, in terms of the structure, process and outcome, we vouch for the structure and process. Okay? Outcomes is something that is individualistic.
Correct.
We do have KPIs, the key performance indicators, which is on our website. So anybody can have a look at that and decide, okay, I want to go to this hospital. So for example, what is the infection rate in this hospital compared to this hospital? You will get it if you are accredited. In a non-accredited, there's no way you can have access to that. So we are giving what? We are giving the assurance.
So they're maintaining certain standards which will assure you of good health care.
Absolutely.
So that's where the accreditation comes.
That's where we act as a differentiator.
Delhi NCR, when they say hospital, they say Gangaram. It's the top of mind along with, say, AIIMS and some of the other facilities. But that's what happens. But if you look at Pradhan Mantri, the PMAY scheme, Ayushman Bharat, and also you need a certain standard for healthcare across all government hospitals across the country. Now, is that a huge challenge? And how is NABH playing a role there in trying to bring all government healthcare providers and hospitals up to a certain standard pan-India?
You see, what we do is, the focus is very different. The focus is accreditation when we do the accreditation.
Okay.
But when we do the empanelment, the focus changes. So what PMJY is looking at, or for example ECHS or CGHS, they are looking at us for empanelment. And that is where they want us to go to the hospital and see, not setting up their standards, but they want to see what that hospital is. How does it compare vis-a-vis to our standards? Okay, that is where we give them, okay, this is where they are. Because PMJY is as a nationwide. And it is inclusive. So it doesn't say only the accredited ones or they will go in. But certainly there is some kind of a check, some kind of monitoring going on, again through QCI and NABH, where we do put in a word and tell the government that, look, this is what is happening on ground. This is the kind of hospitals that you have. And we hope that a whole lot of them ultimately will gravitate towards NABH.
Is there a push from the current government disposition to try and get, at least the newer facilities or those that are getting modernized to also get accredited? Because somewhere government hospitals may not want to get accredited because it's not mandatory for them, because they're not a cost center, they're not fighting for prestige, they're not looking at attracting more traffic onto their own facilities.
Let's take Swachh Bharat.
Okay.
I mean, that was not a private scheme, but the government was very, very keen to make it a success story.
Yeah.
And they did. And QCI was involved in that. So the focus of government is not based on a private and government.
Yeah.
They are focused on quality. And as the PM says, we want quality across. They mean it, he means it, the nation means it.
Means it.
And we believe in him. So the state government, health we know is a state government. So the focus is different in different states.
Correct.
But wherever the word and the wisdom reaches, whichever state, they are keen to join the NABH.
My final question, Dr. P.K. Rao, what is your vision and where do you see healthcare services in the years to come, 2023, 24, next 3-4 years? Are we going to take greater strides? What do you believe is the vision for healthcare and hospitals in Bharat?
In terms of where we want to be, we must look at where we were. And then we know that, okay, what corrective steps have we taken to reach wherever we want? Universal health is our goal.
Yes.
Everybody should have it. But then comes the question of access, affordability, outcomes, quality. Okay? So the government has taken certain steps, which in terms of access, as I told you, they are doing the capacity building, they are increasing the hospitals, the workers are there, whole lot of new doctors are coming in, nurses are coming in, new hospitals are coming in, medical colleges have been increased from up to 650, 1 lakh interns will be there after 5 years. So that is the part of access. Then comes the affordability.
Yes.
And government has launched many schemes now in which affordability, at least for the people who were previously kind of going into debt and then below poverty line, they are now being taken care of. So somebody is there to hold hands with them.
Yeah.
So affordability for them is not an issue. Then when it comes to the other insurances, the people who could afford, their rate or their consumption of insurance is going up very fast. So pan India, that pinch of the bill that comes in your hand will be ultimately taken care of.
P.K. Rao ji, always a pleasure speaking with people like you who've been, voluntarily pushing and dedicated time and so many years towards, a better healthcare infrastructure in Bharat in terms of the quality of service. So thank you so much. Wonderful speaking with you. That brings us to conclusion to a conversation that we need to have. But more importantly, I would suggest, ladies and gentlemen, the next time you're stepping into a hospital, you should ask this question, accreditation hai kya? Thank you for watching.